CNBC-TV18.
Authorization of its COVID vaccine. In its application to the DGCI, the pharma company has sought approval to import the vaccine for sale and distribution in the country. Pfizer has already received permission in the United Kingdom as well as Bahrain to roll out its vaccine. Well, let's understand then, is India ready for the Pfizer shot? What are the pros and cons? Will Pfizer fit the bill as far as India's need for a vaccine are concerned? Let's take you through some of the pros and cons. Let's talk about the pros first. Authorized globally by the United Kingdom as well as Bahrain. United Kingdom is going to start with the first vaccine as early as tomorrow. The cons, no clinical trials conducted in India, and that has been the skepticism point as far as the government is concerned. Another pro is that high efficacy rate of 95%. So that works really well for Pfizer. But what doesn't work is infeasible for storage in India. It needs to be stored at -70 degrees. So that's an issue as far as India is concerned. Another pro is that it's the first COVID vaccine to be ready for use. As I said, the United Kingdom is going to start vaccinating as early as tomorrow. But the cost is a bit impractical for mass usage. So that's going to be a bit of a setback as far as India is concerned. Let me go across to my colleague Sneha Mordani, who tracks the health ministry, to try and understand, is Pfizer going to be a shot which is going to be available for India or not? Sneha.
Well, it's a very good question and also a difficult one to answer. I'll tell you why, Ridhima, because with Pfizer, there are just way too many ifs and buts. Now, one of the biggest if and but here is that Pfizer has been insisting on waiving of the clinical trials, a story that we first reported on how in the conversations with the government, Pfizer said that let's do away with the bridging studies here in India and just get us to give you the doses. We'll sell you the doses. Indian government is absolutely not kicked about this idea. The thing is that if there is a change in the mindset after the emergency use authorization came through in the UK, and after UK, of course, has gotten the first doses of the vaccine, the first mRNA vaccine to get a clearance for treating COVID-19, rather preventing COVID-19. The question is, has there been a change in the thinking within the Indian government? It looks like there has been some room to maneuver that has been given to Pfizer, or else Pfizer wouldn't have gone on to apply for emergency use authorization in India. Now, let me tell you realistically, will you get the shot and will I get the shot right now, or for that matter, even the frontline workers who are on top of the priority list? No is the answer, not right away. Pre-orders, plenty from countries like Japan, the UK, US. Pfizer has its hands full. Pfizer is not going to be in a position to deliver to India anytime in the near future. By near future, I mean maybe a couple of weeks. Pfizer would require that much of time to then sign along the dotted lines if everything comes well, if the EUA is granted, and if Indian government places the orders, like it has placed orders for the GSK vaccine and for AstraZeneca, but it has not placed orders for Pfizer yet. So it's going to be a while before we get our hands on this vaccine.
Right, Sneha. Thanks for putting that into perspective for us. But staying with the vaccine space, how prepared is India? As the government of India draws an extensive distribution plan of the COVID-19 vaccine, the Indian Air Force has now put 100 of its assets, including transport planes and helicopters, on standby. We're anticipating that it will be called upon to airlift the vaccine to the remotest parts of the country. The Indian Air Force has already identified 3 types of assets that will be pressed for this national duty. The heavy lifting of vaccines from pharma companies to 28,000 cold chain storage centers will fall on the C-17 Globemaster, C-130J, Super Hercules and the IL-76. The AN-32 and the Dorniers will be deployed for smaller centers. And then the last mile delivery will be the responsibility of the air-led Cheetah and the Chinook helicopters. Now remember, the vaccine distribution will be the responsibility of a task force comprising Defense Ministry, Health Ministry as well as the Home Ministry. Let me put this into perspective and let's try and understand what the plan of the Indian Air Force will be. How many planes will we be seeing in action? Will this actually impact the regular day-to-day working of the Indian Air Force? Because remember, the last mile delivery is going to be the next big hurdle as far as India is concerned. We are getting a vaccine. The Prime Minister has said that it's a matter of weeks before India gets a COVID-19 vaccine. Of course, a number of trials happening, not just indigenously in India, but abroad as well. So of course the Indian Air Force on standby, putting 100 assets, saying that we're just waiting for a nod from the government. Let's move on. Let's talk about some other stories then. Of course, as we said, this is a race for a vaccine, but the question is, will you take the vaccine the minute it's available? As per a survey by local circles now, a whopping 59% people are saying they're not in a rush to take the shot. They want to wait a little time, better see some sort of a data to come in, and then they will go to take that shot. 22% say they will get a vaccine as soon as it's available. Remember, it's almost been a year now. People are waiting for that vaccine to come. So 22% saying the minute it's available, the minute the government gives its go-ahead, we will go ahead and take that vaccine. So let's try and understand what has been people's approach as far as the COVID-19 vaccine is concerned. 28% are saying we'll wait about 3 to 6 months. 8% are saying the frontliners to get shot from the government. 13% saying we'll wait anywhere between 6 to 12 months after the vaccine has been made available. 7% saying we're ready to even wait till 2022, because remember, by then you would have had enough data that would have come in terms of how effective the vaccine is. 11% saying we'll take the vaccine via private healthcare channel. 22% saying we'll take it via any healthcare channel, and the rest 11% are saying we cannot say. Of course, the survey was had over 8,900 votes. So of course, this gives you a sense of how people are reacting to vaccines today. There is so much talk about, the candidates that are involved, but of course, a whopping over 50% saying we probably are not going to take it as soon as it's available. The other risk of vaccine being available is, will this be black marketed then? Of course, so very high level risk, 46% saying that yes, there is a very high level risk of the vaccine being in the black market. 26% saying there is a high level risk. Then of course, there is average, low, but there's also 10% of the people saying we don't see it happening at all. 4% say we cannot really say. So these are some of the concerns that people have as far as a vaccine is concerned. Let me first go across to Sandeep Taparia, who is the chairman and founder of Local Circles, before I get the medical expert in as well. Sachin, good to be chatting with you again. This is an interesting survey that we're putting out because, of course, everybody is waiting for a vaccine for a really, really long time. And now we're very close to it. The Prime Minister is saying it should be available in a matter of weeks. But still a whopping 50%, over 50% people are saying that they're not in a rush. Why don't you take us through some of the key findings of this vaccine survey?
So, Ridhima, we had done a very similar survey at the end of October, before all the 3 vaccines were announced, the Pfizer, Moderna, and the AstraZeneca, Oxford. And at that point, the number was 61% people basically believing that they will not be, they will not rush to take the vaccine. So that number, when the 3 vaccines were announced, we decided to do this poll again. And this was between November 23rd and 25th when the AstraZeneca Oxford vaccine serum, was announced. And the numbers were, it was about, 44 to 45% people were hesitant. But then what happened was there was some questions raised by the experts on the AstraZeneca Oxford study, their results that they had announced, and the adverse event that was announced here in India. So that actually, increased the percentage from 44, 45 to 59% people being hesitant. So I think the key here really to get the citizen buy-in is to, ensure that there is full disclosure from a public standpoint, successes as well as any adverse events. And there is continuous, awareness being created, and especially now that the UK and the USA is going to go into vaccination. I think the government and the industry both need to kind of, get on the front foot and communicate in a transparent and in a very timely fashion with people. And I think, eventually more and more people will come on board and become comfortable with the idea based on, what comes out.
So the more data that we have and the more transparent that data is, you're going to see more and more people come on board. Let me bring in Dr. Rajesh Parekh as well, who's the Director Medical Research at Jaslok Hospital and Research Center. Doctor, good to have you on the broadcast with us. What I'm trying to understand is that people have been waiting for a vaccine for a really, really long time, but people also need to be sure of how effective that vaccine is going to be. What are some of the, precautions, also some of the kind of the data that the government ideally should be putting out for people to have more confidence and to go ahead and take that vaccination, because that's the only way to contain this virus?
Well, thank you for having me on your show. Always a pleasure to be with you. And I am in complete concurrence with what you said and what Mr. Taparia just said. Transparency is non-negotiable. It has to be an inherent component of any kind of research and any kind of rollout that affects the lives of so many people. And it is to be expected that certain people would be cautious. I'm pleasantly surprised, in fact, that there are no vaccine deniers in this survey, unless they didn't look for them, which is another matter altogether. But there has to be transparency.
Yeah.
And there are for concern. Before I get to them, I'm not, troubled by the percentages that were shown. There's no reason to be perturbed. It's not as if we are going to have the vaccine ready for every single person in the country on day one.
Yeah.
And so if a certain percentage is ready, they get it first. And gradually the confidence will build up. And mind you, this confidence is not going to be built up based on how many people take it, but it is going to be directly proportional to the degree of transparency. So let me tell you what the issues are. The biggest issue is safety. People need to be assured of safety. And there is a glaring example. Just 3 years ago, the dengue vaccine was absolutely ready for a rollout in 2017, when fortunately they discovered a rather worrisome side effect. And that is, while it blocked the entry of one type of dengue vaccine, it actually enhanced the entry of another virus due to a process called ADE.
Yeah. Yeah, so of course that is a concern that most people are seeing, and that's why transparency is need to be of the topmost priority, because people need to be sure of how effective and how safe the vaccine is. I'll request Sachin as well as Doctor to just stay back with us. We're also getting some more developments as far as the vaccine race is concerned. Government sources now telling CNN News 18 that Pfizer is keen on the government in India to do away with the clause as far as which means that the government of India will be the authority giving out the compensation if there are serious side effects of the vaccine. The liability will not be on Pfizer but on the government of India. And this is what Pfizer is insisting on. Of course, the government of India is not going to be very, very happy about this. Let's try and understand what this really means. Going back to Sneha Mardani, who tracks the health ministry. Sneha, this is a very important clause, which means if there is a side effect that we've seen when the vaccine is taken, the liability will be on the government and not on the vaccine candidate.
Yes, absolutely. That's what Pfizer really wants, and that's where, again, the conversation has not really been conclusive. I'll tell you why, because the government of India is ready. Now, also, Ridhima, let me draw a quick comparison with what the UK has done. The UK has given Pfizer that sort of a protection. It's basically protecting them from a legal indemnity and from being sued, enabling the vaccine to be rolled out across the country. Pfizer has been insistent on this, that they have to get this sort of a protection. They've got it in the UK. But remember, UK is very different from India. Can a country like India, a low-income country, limited resources, be in a give this sort of a cover to Pfizer? Is it going to be in a position? Now, 12 crore rupees has been given, is what the government of India, rather the DCGI, has told us himself just 2 days ago in compensation. We don't know the time phase of that, but just 12 crore rupees. That's a very, very small figure when it comes to clinical trials. However, that kind of money that is paid out, if there are any sort of an adverse reaction or if there is any sort of a legal case that's built up, Pfizer wants that protection from the government of India, the manner in which it has gotten it from the government of the UK. But I don't know if India is going to be in a position to do so, and if that really is going to be a deal breaker, or whether there's going to be some sort of a middle ground that these both these parties here, government of India on one hand and Pfizer on the other hand, arrive at, so that there is a different sort of an approach in India, because Pfizer also
Right.
knows that India is not the UK, and what they do get in UK is not possible for them to get here in India.
Absolutely, Sneha. So that's still going to be another bone of contention between Pfizer as well as the government of India. Let me go back to Dr. Parekh. Dr. Parekh, many are saying that the skepticism of people not wanting to get vaccinated the minute it's available could also come from the fact that there is still a lot of ifs and buts in terms of doubts that people have. For example, many people wrote to me asking that we're still not clear who all need to be vaccinated. For example, if somebody who's recovered from COVID, do they also need to go ahead and get vaccinated? Would you help us allay these concerns? Because this will also help people understand in terms of how urgent their need is to get vaccinated.
Well, my quick answer to a specific question is yes. Those who have recovered will need to get vaccinated, though not in a great rush. But if you do want me to give in my 2 bits on this demand for waiver of any kind of responsibility, legal responsibility to be indemnified against any damage on Pfizer, I do have a point of view, but for that I'd need a minute.
Sure, please go ahead.
Okay, so first, by way of disclosure, amongst other scholarships, I received a Pfizer medical scholarship through medical school. That was 47 years ago. And about 25 years ago, I did clinical research for Pfizer on an antidepressant, which is now available in India, for which I did get paid. That's my financial disclosure. Having said that, I think it is ridiculous on behalf of Pfizer. My gratitude to them for my medical scholarship, but I'm also an Indian and a doctor.
Yeah.
And I think it is ridiculous to expect an unconditional waiver. I can understand the concern because the efficacy of the vaccine is also dependent on it. There could be an error in that.
Yeah.
And but to say that you want an absolute indemnity, I don't think that's fair. And I think that definitely needs to be negotiated. It could be partial indemnity. I mean, okay, if there's a screw up on maintaining the cold chain, it's understandable. But until that is clearly established, until it is established that there was a distribution administration error, I think the full liability should be on the people who are benefiting from the sale of the vaccine.
Absolutely, and that's why, will India actually get the Pfizer shot? There are a lot of hurdles that need to be crossed between Pfizer as well as the government of India. Sachin, I want to come back to you and talk to you a little more about the survey. Somebody would, assume that, we waited a year and now when the vaccine is here, almost everybody would say that, yes, of course, we'll jump and take the vaccine. What were some of the key reasons as to why people will still want to wait and watch? Is it just the sheer fact that we want more data to come out to see how effective the vaccine really is?
Absolutely, Ridhima. It is people are worried about the side effects, what's being reported. And, there's been talk about neurological complications in some of the adverse events and such. So I think there is just concern and the fear of the unknown as to what this vaccine means, like Dr. Parekh suggested or, said in his example of dengue vaccine, right? People are just, they are skeptical, they are unsure as to what this means. And I think if all goes well, I think 3 months down the road, if the same survey was conducted, I think you'll see a much higher, approval or a much lower hesitancy percentage. So I think it's just the fear of the unknown, basically.
Absolutely. So we're hoping that we have positive results to show so that more and more people can be vaccinated. Sachin as well as Dr. Parekh, always a pleasure talking to you. Thank you for taking our time and joining us here on CNN News 18. But we've got some breaking developments now coming in. NCP Supremo Sharad Pawar will meet the President of India, Ramnath Kovind, at 5 p.m. on the 9th of December. This is to discuss the farmer protest issue. So, of course, the NCP also now jumping in. You've got Sharad Pawar, who's taken time to meet the President of India. He will be discussing the farmer protest. Let me go across to a special correspondent, my colleague Payal, who's getting us these breaking developments. Payal, what more can you tell us?
Well, NCP chief Sharad Pawar, remember, whose party is said to be a party of farmers, essentially is taking up the matter with the President of India. Remember, the President of India took quite some time before he actually passed, gave his approval to the farm bills which were passed by both houses of parliament. Essentially, that is what Sharad Pawar is going to do. He's going to raise his concerns about the safety and the security of these farmers who are protesting on the streets leading up to Delhi, and also will ask and appeal with the President of India to allow permission for a special session of parliament to be convened and the farm laws to be scrapped.
Absolutely. So politics once again, escalating as far as this, logjam between the government and, the farmers concerned. Because, Payal, remember now even you've got the Congress jumping in saying that we support the farmer protests as well as the Bharat Bandh. So, of course, the opposition leaving no stone unturned to attack the government at a time the logjam still continues.
Well, the opposition certainly will be making the most of this issue. If you remember, Ridhima, when this bill was passed in Parliament in September, you saw the kind of scenes that actually panned out in the Rajya Sabha, especially where the opposition has a reasonable amount of numbers. So whether it's the Congress party MPs, the Trinamool Congress or the others who were suspended, from the session for actually charging as a chair in opposition of the bills being passed on that day as well. So that has been, the bone of discontention between the opposition and the government from that day onwards, and it will continue in the coming days because, the opposition parties feel that the government doesn't give a hearing to anyone and the government works according to a dictator as a kind of a rule.
Absolutely, Payal. Thanks for getting us all those details. And we've got some more breaking developments coming in now. On a bid to hijack the Kisan stir, banned radical outfit Sikh for Justice have now called in for a rally in the United Kingdom on the 10th of December. Remember, SFJ is an illegal and banned organization in India's eyes. The United Kingdom is also not keen on giving a go-ahead for the rally as this is in the middle of a pandemic. The Indian government is maintaining that farmers' movement is purely an organic movement driven by local sentiments. Farmers are not under any influence with any foreign organization. So what does this really mean? Let me go across to our executive editor Anand Narasimhan is joining us. Anand, the government is not going to be very happy about this. United Kingdom government also doesn't want to give a go-ahead for this.
Well, good afternoon to all our viewers and good afternoon to you. The biggest issue is that the Sikh for Justice is an ISI plan. The Sikh for Justice has got no representation of Sikh. The person who's leading this, Gurpatwant Pannum, has been himself is a plant of the ISI, and he's not even a Sikh in the true sense. So he's also a poser. So it is the whole thing, the whole narrative itself is flawed, and it is driven by a nefarious agenda. And the other part is that he fled from Canada because he was fearing arrest, and he was relocated by the ISI. They have started getting active ever since the farmer protests have started. Captain Amarinder Singh has also flagged this off. And there is in the United Kingdom, within the parliament itself, there is a pro-India lobby and there is a pro-Pakistan lobby. So this is the entire set of Pakistani groups which are now trying to get this active and trying to build this on ground to try and show their solidarity with Sikhs. But that is the hypocrisy of it all. This is a nation that does not respect Nankana Sahib. This is a nation that has now usurped the management of the Kartarpur Sahib. This is the nation which is using Kartarpur Sahib and the places of worship for Sikh for their Khalistani agenda and for their nefarious agenda. This is a nation which has even replaced the domes of the Gurudwaras with plaster of Paris. That's what they have done, and they have also demolished and desecrated, allowed the desecration of various places of Sikh faith, on Pakistani soil right now. So the hypocrisy is writ large. But the biggest issue is during the pandemic, the UK government does not want any rallies. But the Sikh for Justice movement had a failed referendum 2020. It just bombed in its face. So this is the ISI trying to reactivate it. And if you were to see on social media, it is all Pakistani handlers which are trying to push this. Their origins are from Pakistan. Their origins are not, Sikhs or farmers. And what are farmers going to do on Twitter? Farmers want their need to be addressed, and and they will engage with the government. And this is at a time when talks are already on. So this is purely with a nefarious agenda. Pakistan has always followed a K2 policy, that is Kashmir and Khalistan. So this is all being activated and being done at the behest of the ISI. The government is aware of this, and they've also made the UK authorities and their counterparts aware of this in the United States.
Absolutely, Anna. Thanks for getting us all those details. Well, with that, we are completely out of time on this edition of the news broadcast. Slipping into a very short break. News and updates continue on the other side.